We're at the Mackinac Policy Conference on behalf of the Michigan Health and Hospital Association and the Common Bridge podcast and Substack page. And we have the honor today of talking with former Michigan U.S. Senator Debbie Stabenow. Senator, thank you so much for joining us.
My pleasure.
How have you been enjoying the conference so far?
Oh, I love this conference. I've been coming up here for a long, long time. I come up every year. Way back when I was a state legislator chairing the Economic Development Committee. I've been coming up a long time. And the weather today is beautiful, absolutely phenomenal.
We asked the Chamber of Commerce for this, and
You did a good job.
we should tell the audience that every day is like this in Michigan.
Oh, absolutely.
Bad weather, just a rumor.
Yeah, no, it's just, it's always 70, 80 degrees, gorgeous.
Indeed, it is.
Yeah.
So tell us, what have you been up to lately?
Well, I'm working, healthcare is my passion. And so even though I'm retired, I'm still staying engaged on healthcare access and mental health access. I led major reforms with a Republican colleague of mine, Roy Blunt, in Congress to transform community mental health, create what we call community behavioral health clinics that have 24-hour access so that folks don't have to sit in the emergency room or in the jail to get help, that we can get people help that they need. And so that's been a passion of mine. And then I've just been deeply concerned about what has happened on the cuts. When we see the cuts in Medicaid, the cutbacks on affordability, tax credits for people in ACA, and costs for people going up, tremendously, and so on. So I've been, even though retired, I'm still engaged in that and representing the beautiful state of Michigan, which is geographically a huge state. And now I'm spending a lot of time up in northern Michigan, where our rural hospitals, frankly, have just been slammed. And when we see hospitals that can no longer be full service but cut back on beds and go to be critical access, or too many of them can't deliver babies anymore, too many of them can't provide the services needed, and that's just plain wrong and deeply concerning to me.
Yeah, the critical access hospitals have been kind of a political football that's been kicked around a lot, and they're necessary. And economically, they don't pencil out, but caring for people in the community.
Right. Well, and actually, when you look at the local hospital, and I should tell you, I got into interest in healthcare because my mom was director of nursing at a small rural hospital in Michigan when I grew up. And I saw how hard she worked as a nurse. I saw how hard the doctors worked. I also saw that the hospital was the biggest employer. And that's true today. Our hospitals up here are the biggest employers, even whether it's Henry Ford in Detroit, whether it's Munson in Traverse City, whether it's Marquette. And so they're the largest employer. They're part of the reason people come in to live in a community if they know they have access to health care through the hospital. And so that's a driver. And then the most important thing is that it's just the care that people need. I mean, I'm a fundamental believer that healthcare should be a right, not a privilege in this country, and we can decide how it's fashioned, but it should be something that's affordable and available.
Well, I just want to punctuate the point and emphasize the point about the people that work inside healthcare. That's what attracted me to healthcare, was the just passion and sense of service and sense of mission, and they're doing the best they can. And well, frankly, from a policy standpoint, we often impede them,
right,
if not, outright prevent them.
Yeah.
And there's been attempts. Now, you were an author of the Patient Protection Affordable Care Act, and that is an act that was purported to lower everybody's premiums by $2,500 and keep your own doctor. That didn't work out. If you had to go back and look at that legislation, what parts would you keep and which parts would you maybe modify?
Well, first of all, I wanted to see a public Medicare option to keep private insurance companies honest in terms of real competition on price. And I think we were close, but we were a couple votes short of making that happen, which I think would be a significant change that in terms of competition there. I think on the positive side, not allowing insurance companies to drop people with pre-existing conditions is incredibly important. I can tell you as the author of a number of the provisions of essential care, including women's health care, we had a big debate in the Finance Committee where, being pregnant as a woman was viewed as a pre-existing condition, and prior to the Affordable Care Act, you had to get a rider if you thought you were going to be pregnant or wanted to be pregnant, or you paid a penalty. You couldn't get health care. About half of the insurance companies in the country didn't offer prenatal care and pregnancy care, and so one of the things I did was make sure that the essential services included women's health care. And I'll never forget in the Finance Committee, a colleague of mine from Arizona, Senator Kyle, moved to strike that out. And he said, well, we shouldn't have to pay for things we don't use. I don't need women's health care. And I said, yeah, but I bet your mom did. And everybody responded like you responded. And we defeated it. We defeated it. But it's sort of like, you know what? One of the fallacies around healthcare policy is that somehow you can disconnect things. And so it's all connected. I mean, whether it's research or prevention or, primary care it's all connected. And which is also one of the problems with cutting a piece of it. You just increase emergency room care. And so it's like,
You made a strong point, and one place that I've had many discussions about healthcare policy, and no matter where you're coming from in the political spectrum, people understand that the employer-sponsored healthcare is a thing of the past. It worked maybe when some went to work for Price Corporation and were 40 years and retired from there. And we have many tax-supported healthcare plans, Medicare, Medicaid, trying to VA, so push that rail. And we'd be a lot more efficient about it if we just made it one plan and pay for it off the 1040 on a sliding scale, just like Medicare Part B, and problem solved.
It'd be a lot, but there's so many interests.
I'm going to lose listeners and viewers over that.
No. But there's so many just interests, right, within all of this, private sector interests and other interests, that healthcare is really complicated. I mean, that's one of it. It shouldn't be complicated. We don't want it on our end as a consumer to be complicated. We want to know that it's there when we need it, that we can afford it, that we can afford it for our kids and parents, and whether it's beginning of life or end of life. But it is for many reasons, longer than we could take on this podcast. It's complicated and been tough to change.
Indeed. And where do you see some of the opportunities for change now that are politically viable?
Well, right now, the problem is you've got two parties, one of whom just wants to cut everything. I mean, the Medicaid cuts have already happened, and privatize Medicare or privatize the VA, but not have a seamless system, and so you've got one group that really just is very negative to healthcare at all, healthcare coverage. And then you've got the other side that wants to provide healthcare, but argues over what that means. Does that mean Medicare for all? Does that mean a public option as part of what the choices are? What does that mean? And so, but the biggest problem is deciding as a country that healthcare is something that we should design in a way that everyone has the access they need and that it's affordable, and that is not a frill. I mean, we're still debating as a country whether healthcare is a frill, and yet we all know it's not. Nobody individually would think it was, but it shouldn't depend on whether or not you're a very wealthy person, or if you've had a long time job in the same job where you've been able to, to get your health care. And so the politics of healthcare I find so frustrating because it's just a common need, and we should be approaching it from that standpoint.
But didn't Medicare Part D work out pretty well?
It did, except the provision that the pharmaceutical companies got in that Medicare cannot negotiate price. Every other country negotiates. Every other country. We pay more than anybody else in the world for our prescription drugs. Every other country negotiates best price. But the most powerful, one of the two most powerful lobbies in Washington are the pharmaceutical industry, and they were able to get language prohibiting Medicare from negotiating. That was the big problem right there. So
was the debate around whether it was the manufacturer or the distributor or the retail level, or was it just across the board?
No. They were able to get language in to stop all of it. And so then we had PBMs, the pharmacy benefit managers layer come in, supposed to save costs, up to costs. So there's a whole thing that happened there. But
Senator, any final thoughts for the wonderful audience?
Well, I have to say, I think that the folks providing our care, whether it's the doctors, the nurses, the folks at the hospital itself, those are the folks on the front line. They have to deal with all the regulations, all the payment cuts, all these things coming at them, and yet they are the ones that are working hard every day trying to figure it all out so they can provide care for people in their community. And so I just give them a big thank you every day.
Well, let me amplify that thank you to the caregivers, the doctors, the nurses, the radiology techs, the laboratory techs, the phlebotomists, the transport people that wheel you in, the people that shovel the snow. Wait a minute, we don't get that, do we? It's just... and with our guest, the distinguished and honorable Senator Debbie Stabenow, on behalf of the Michigan Health and Hospital Association and the Common Bridge podcast and Substack page, this is your host, Rich Helppie, signing off.